So guys, next let's talk about the brachial artery. We'll talk about the branches of brachial artery in the arm around the elbow, and we'll also look at the anastomosis around the elbow joint. Just like there is an immense importance to the scapular anastomosis, even elbow anastomosis is very important. So if in case there is a compression of the brachial artery in the lower part, still with the help of that anastomosis, the collateral circulation can be maintained to the forearm and the hand. So here we go. Let's look into the brachial artery and its branches, and along with that we'll look into the anastomosis also. First, let me tell you about the branches here. Now imagine if this here is the lower end of the humerus. Just trying to keep it very simple here. Let's say this is the lower end of the humerus here, and if you presume this here is the lateral side and this is the medial side. As we know, brachial artery runs in the anterior compartment of the arm, and in the cubital fossa you will be seeing the brachial artery dividing into the radial artery and the ulnar artery. So this here I'm writing BA here for the brachial artery, that is brachial artery supplying the anterior compartment of arm, and in the cubital fossa it is going to divide into the two, that is this on the lateral side here is the radial and this one is the ulnar artery. Now, if you look at the lower limb and upper limb, there is one thing which we need to compare here. Like lower limb is having a femoral artery and upper limb is having brachial artery. Femoral artery somehow need to supply all the three compartments. So, and brachial artery here need to supply two compartments. Arm is having two compartments, anterior and posterior, but thigh is having three compartments. But major artery is one only. So, how that artery will give off the branches and will compensate to supply those different compartments, that is something very interesting to understand. Like if I first talk about lower limb, the femoral artery supplies anterior compartment, then the profunda femoris artery goes toward the medial side and deeper supplies medial compartment, and we also have perforating branches from profunda femoris artery supplying the posterior compartment. So that's how all the three compartments of the lower limb can be taken care of, mainly by the femoral artery only. In the arm, the things are a bit more simple, because brachial artery is supplying the anterior compartment and we have the posterior compartment to be supplied. For that, what you will see, the brachial artery will give off a branch which runs in the spiral groove, you know, the spiral groove or the radial groove in the shaft of the humerus. And then when it comes toward the lateral side, a branch will be seen reaching the anterior to the lateral epicondyle, and there will be a branch which is running and reaching posterior to the lateral epicondyle like this. So first and the foremost, this artery here which is running in this spiral groove or radial groove, this artery here is a profunda. Profunda, you know the meaning of profunda is deep. So this artery here is a profunda brachii artery. I'm writing PBA, that is profunda brachii artery. Dividing into this branch, that is the anterior descending branch. Let me write just A here only, that is an anterior descending, it is coming down, so we call it anterior descending branch. Whereas this one here is called as a posterior descending branch of profunda brachii. What exactly is the fate of these arteries? Which artery will anastomose with this? We will discuss that in the next part. I first want to show you the major branches coming from brachial. Now, this profunda brachii artery is going deep and toward the lateral side. What about the medial side? On the medial side, the brachial artery gives off a branch which is seen running behind medial epicondyle. It is seen reaching behind the medial epicondyle, and there's another artery starting from below which is reaching in front of the medial epicondyle. Now guys, this artery here is running along with the ulnar nerve. We all know ulnar nerve goes behind medial epicondyle. So that artery we have marked here is the one which will go behind medial epicondyle along with ulnar nerve, and this artery compared to this one is superior. So this is called as the superior ulnar collateral artery. Superior ulnar collateral artery. Don't have to mug up these names. It's all, the meaning is residing in their name itself. Superior ulnar collateral artery running along with the ulnar nerve, more superiorly placed. So superior ulnar collateral artery. And this one in comparison is inferior. So we simply call it inferior ulnar collateral artery. That is inferior ulnar collateral artery. So these are the major branches from the brachial artery that you should remember. I repeat again, that's a profunda brachii artery running in the spiral groove or radial groove. It gives off a branch which comes toward the lateral side, pierces the lateral intermuscular septum, comes in front of the lateral epicondyle. In fact, there is something interesting you should know about this artery here. This artery, the one which I'm highlighting here, the anterior branch or so-called anterior descending branch of profunda brachii is seen running along with the radial nerve. Even the radial nerve runs in this groove, and then radial nerve comes in front of the lateral epicondyle. Then radial nerve will go deeper by the posterior interosseous branch. But yeah, radial nerve comes in front of the lateral epicondyle initially. So this artery, because it runs with the radial nerve, this is also called as the radial collateral artery. It is called as a radial collateral artery. Why? Because it is running with the radial nerve on the lateral side. Just like radial nerve also comes in front of lateral epicondyle, this artery will also do that. One more information which I can add from here is that profunda brachii artery, when it runs posteriorly, is the one which will give up nutrient artery to the humerus. Nutrient artery to the humerus come from where? From the profunda brachii. Let me write that here. The PBA, the profunda brachii artery, it will provide the nutrient artery to humerus. Nutrient artery to humerus come from the profunda brachii. So these are the major branches that you should remember before we go to the anastomosis. That brachial artery gives a profunda brachii, which divides into two further branches on the lateral side, and on the ulnar side it gives off a superior ulnar collateral, inferior ulnar collateral, and additionally you should also remember that nutrient artery to the humerus comes from the profunda brachii itself. What is the fate of radial artery and ulnar artery in the forearm and in the hand? We will come to that. But before that, let us talk about a very, very important anastomosis here, and that is the elbow anastomosis, the anastomosis around the elbow joint. So I'm going to redraw a few of the things from here, and then we'll discuss that. Now you already have an idea about the artery and its branches, so I'm going to draw it very, very simple, guys. Let's say this here is a brachial artery. Let's keep it in a schematic way, dividing into this radial artery, and here we have the ulnar artery. As we already said, from the brachial artery, there is this profunda brachii artery, which is giving off one anterior descending branch, if this is the one, and there is one posterior descending branch. Let's say this is the one which I'm keeping it dotted. Obviously, it is posteriorly placed. Needless to say, this in this diagram, this has to be the lateral side. So let me just write L here. That is a lateral side, and this is going to be the medial side. Profunda brachii artery. This is the anterior descending branch, also called as radial collateral artery, and this is the posterior descending branch. Okay. What was the scenario on the medial side? On the medial side, we had a superior ulnar collateral artery. There we go. This is a superior ulnar collateral artery, which ultimately goes behind medial epicondyle. Let's say that's why I'm putting this lower part dotted. And then we have this inferior ulnar collateral artery. Let me write in short here. This is the superior ulnar collateral artery, and this one is inferior ulnar collateral artery. Okay. We already discussed that, so nothing new. What about this radial artery and this ulnar artery, guys? Out of the radial and ulnar artery, it's the ulnar artery which gives off common interosseous artery in the forearm, and then that common interosseous artery divides into anterior interosseous and posterior interosseous. Something like this. Let's say there's an ulnar artery here. This is the one giving off the common interosseous, and then common interosseous artery gives off a posterior interosseous artery running behind the interosseous membrane, and anterior interosseous artery running in front of the interosseous membrane. There is something interesting about these two arteries. I'll tell you in a while. Let me write the name, guys. This here is the common interosseous artery. CIA, common interosseous artery, dividing into this anterior interosseous artery and posterior interosseous artery. Make sure you keep writing all these full forms, please. Common interosseous dividing into anterior interosseous and posterior interosseous. So obviously we need to have some branches from here to go back and anastomose with these branches to form the anastomosis around the elbow. Okay, let me start from the medial side first. Now ulnar artery gives off two branches. One goes and anastomose with this one, and one goes and obviously behind the medial epicondyle and anastomose with this one. So as you can clearly see, there are two anastomosis being formed here, this one and this one. Now what arteries are these? How will you name these arteries? Both these arteries are going back. So their name is what? Recurrent. Coming from where? Obviously ulnar artery. So they are recurrent ulnar artery. But one is going in front of the medial epicondyle and one is behind the medial epicondyle, and that's how they're named. One is anterior and one is posterior. So this one here is the anterior ulnar recurrent artery. Anterior ulnar recurrent artery. And of course, this one here is the posterior ulnar recurrent artery, or you can say recurrent ulnar artery. Ulnar recurrent or recurrent ulnar. So it is very, very important to see that which one is anastomosing with. I mean, again, you don't have to mug it up. Guys, I already said superior ulnar collateral artery goes behind. Inferior comes in front. So obviously, inferior ulnar collateral artery anastomose with anterior ulnar recurrent artery. Right? If I just try to give them a common shade here, it's the inferior ulnar collateral artery anastomosing with the anterior ulnar recurrent. What about on the lateral side? On the lateral side, the anastomosis goes something like this. Now, this radial artery gives off a branch which goes back and anastomoses with this one. Now, that's a simple one. There's an artery going back from here. So, simply call it recurrent radial artery or radial recurrent artery. So, this one is called as a radial recurrent artery, and you can see it is going and anastomosing with the anterior branch. So there's another anastomosis formed here, which is obviously in front or behind. It is in front of the lateral epicondyle. Now, this is the one you got to remember here. This posterior descending branch, which is going behind the lateral epicondyle, will be anastomosing with another recurrent branch. But the question is where that recurrent branch is coming from. Well, that is coming from posterior interosseous artery. Now, this is something you have to remember. Guys, from the posterior interosseous artery, there is an artery which will go back all the way behind lateral epicondyle and anastomose with this here. This artery here, the one which I just drew here, let me just label it here. This is called as the recurrent interosseous artery. We call it recurrent interosseous artery, although the name is recurrent interosseous artery, guys. But remember, it is not coming from common. It is coming from posterior interosseous artery. It is a branch going back from the posterior interosseous artery. And that is how the anastomosis around the elbow takes place. Mainly, these are the four. The fourth one is here. So we got one anastomosis, which you can see here, which is between the anterior branch of profunda brachii and radial recurrent. The one which is behind the lateral epicondyle is between posterior branch of profunda brachii, posterior descending branch of profunda brachii, along with recurrent interosseous artery. Then we have the two more on the medial side, one in front of the medial epicondyle, that is between inferior ulnar collateral and anterior ulnar recurrent, and of course the one which is left here, that is between the superior ulnar collateral artery and between the posterior ulnar recurrent artery. So the four major anastomosis that you will see around the elbow joint. Well, this thing will make more sense when we'll see it in a picture also. Let me show you one atlas image and let's try to identify those, mark those arteries in that image also. So here we go. Let me take you to this picture. Okay, so guys, that is the image in which you can see that's a brachial artery. Let me just keep labeling all these for you. That is a brachial artery here, right? And you can see the brachial artery is giving off this branch which is going back. That is a profunda brachii artery, the PBA, the profunda brachii. And if you look very carefully, can you see the profunda brachii artery, when it is running behind, it is giving off one branch which is coming here in front and one branch which is like present behind. So this one here is a radial recurrent artery, also called as anterior descending branch of profunda brachii, anterior descending branch. And this clearly is the posterior descending branch of profunda brachii. The story on the lateral side. On the medial side, look at this artery here coming from above here. What is that? That is a superior ulnar collateral artery. Superior ulnar collateral artery. Let me enlarge this picture more. And look at this one here. That is the inferior ulnar collateral artery. Right? If I enlarge this picture even further, you can see the anastomosis around the elbow. Can you see that these arteries anastomosing here, guys? This obviously is the ulnar artery. This one below. This here is the radial. And can you see the two branches coming from the ulnar artery and going back? Now look at this branch here. The one which is coming in front of the lateral epicondyle is anastomosing with the inferior ulnar collateral. So this here is the this anterior branch of anterior ulnar recurrent artery. Anterior ulnar recurrent artery. And this one here is the posterior ulnar recurrent artery. Anastomosing with these branches respectively in front and behind the medial epicondyle. On the lateral epicondyle, we already said the anterior branch. Guys, look at this. Trace this. Anterior branch here is anastomosing with the branch coming back from the radial artery only. Radial recurrent artery. So that's a radial recurrent artery in there. And the one artery which I told you to keep an eye on, let me try to enlarge it even further. Look carefully, guys. Can you see that common interosseous? That is common interosseous. And this is dividing into anterior interosseous here, this one, and that is posterior interosseous. Now look there. From the posterior interosseous artery, look at this artery running behind the upper end of the ulna. Goes back like this. Look at that. Let's trace my pointer here. And then anastomosing with that posterior descending branch. That is the anastomosis behind the lateral epicondyle. This here is the recurrent interosseous artery or interosseous recurrent artery. Recurrent interosseous artery. That is how the anastomosis, a rich anastomosis around the elbow is formed. Though you can see few more things in here. Can you see this inferior ulnar collateral artery? If you look carefully, it is giving off a branch which is going back like this. Look at that. It's going back like this and anastomosing with the branch that is with the posterior descending branch. So there is an anastomosis at the back also above the olecranon fossa. What is the fossa over there on the posterior side? Olecranon fossa. So there is another anastomosis present above the olecranon fossa on the posterior side between what? Between the inferior, a branch from where? Inferior ulnar collateral artery and a branch from the posterior descending branch of profunda brachial artery. They are also anastomosing with each other behind and above the olecranon fossa. Now the question is, what is the fate of this radial artery and ulnar artery in the forearm and how these arteries are going to behave in the hand? Now, as you already can see from here itself that it's the ulnar artery which is taking care of the major compartments in the forearm because it is giving off common interosseous artery and having anterior and posterior interosseous which are obviously going to supply the anterior and posterior compartment of forearm. Before I help you understand these fate of these arteries in the forearm and especially in the hand, let me show you another picture here and we can go on from there. Okay. Now guys, try to look at this image and first understand this here. Once again, that is the brachial artery, right? And you can see the brachial artery here at close to the head of, exactly at the level of the head of the radius. That is the point. At the head of the radius, it is dividing into radial artery which is going toward the lateral side and more superficially placed. And the more deeply placed here is the ulnar artery and there is a common interosseous. Now first thing is when you see common interosseous artery giving off both anterior and posterior interosseous. Now look at this anterior interosseous obviously will be running in front of the interosseous membrane. Let me just shift this image. It is running in front of the interosseous membrane and what you will see, this anterior interosseous artery will not go through and through till the wrist joint. Anterior interosseous artery will pierce the interosseous membrane and will be running then on the posterior side. Although we call it anterior interosseous artery, but in the lower part of the forearm, the same anterior interosseous artery, deep to this muscle, there is a muscle here called as a pronator quadratus. Deep to this pronator quadratus muscle, pierces the interosseous membrane and goes on the posterior side. So the name itself is it says anterior interosseous, but what you'll see in the lower part, the anterior interosseous will come at the back. Okay. So what is interesting here, before we go to the hand part, something to be remembered. Let me just note it down for you. So as we said, the brachial artery dividing into two, that's the brachial artery once again here. Here is the radial artery and this here is the ulnar artery. Now, what is the fate of the radial artery and ulnar artery in hand? We will see that in a minute. I wanted to understand this, that common interosseous artery giving off anterior interosseous, which is obviously running in front of the interosseous membrane, and we have a posterior interosseous which is running behind the interosseous membrane. Now let's presume this here is an interosseous membrane. I'm just using a green color here, and that is, let's say this here is an interosseous membrane. The common interosseous artery, anterior interosseous. This is something very interesting here, and this is the posterior interosseous artery. Obviously, this green thing in between, let's say that's an interosseous membrane, just a schematic presentation. Now, what I just showed you, that anterior interosseous artery is not reaching the wrist joint. What you'll see, anterior interosseous artery in the lower part will pierce this interosseous membrane and will be seen running posteriorly in this manner. That means posterior interosseous artery is like relatively smaller than that. It's the anterior interosseous artery piercing the interosseous membrane and running behind like this in here. Now, why I'm stressing so much on this? Because first of all, there could be a question like that, which of the following structure pierces the interosseous membrane? And the options will be like anterior interosseous nerve, posterior interosseous nerve, anterior interosseous artery, posterior interosseous artery. So clearly your answer is obviously the anterior interosseous artery, which is piercing the interosseous membrane. It pierces the interosseous membrane. That is one thing. Secondly, why it is important to understand this here? Because when people read about this, the flexor retinaculum and the extensor retinaculum. Now we know, guys, in the extensor retinaculum, we have like 6 compartments. I will discuss that with you. And in one of the extensor compartment retinaculum, what you will see, that the nerve which is running here is a posterior interosseous nerve. No problem. Obviously, the nerve supplying in this region is a posterior interosseous nerve. But the artery in the same compartment will not be the posterior interosseous, will be the anterior interosseous artery. Now, this is something you have to keep it in mind, that while looking at the extensor retinaculum, in one of the compartment of extensor retinaculum, the nerve will be posterior interosseous nerve, obviously. But the artery there will be anterior interosseous artery. I don't want you guys to be confusing this later on. Ki yaar, we are looking at the nerve is posterior interosseous nerve. The artery should be posterior interosseous. No. Artery will be which one? Anterior interosseous, because it pierces the interosseous membrane and goes behind. So just for the relation purpose, like posterior interosseous nerve will be running like this all the way, and anterior interosseous nerve will be like this. So nerve, if I talk about, that is anterior interosseous nerve. As we know, it is a branch of median nerve, and this is posterior interosseous nerve, which is a branch of radial nerve. The branch of radial nerve. So that's one important relation you have to remember, that in the extensor retinaculum, you will see these two structured together. Nerve will be posterior interosseous, but the artery will be anterior interosseous artery. Now, let us talk about the fate of this radial and ulnar artery in the hand. Now, that is very, very important, that how this radial and ulnar artery are going to reach the hand and what kind of arches they will form. Like there are 2 arches in the hand. One is called as the superficial palmar arch and one is a deep palmar arch. How these arches are formed and how they are completed, that again could be a good question to be asked. So let's do one thing. Before we talk about these, the superficial and deep palmar arch, I'm going to draw these arches on my hand and we'll show you that how exactly they are, so that you have a better orientation. Try to understand that on my hand, and then we'll draw it also and understand it on the paper also. So let us try to understand the fate of the radial artery and ulnar artery on hand here, and then we move on to drawing a diagram and understanding it there. So guys, as we already said, that radial artery is the one which is running more superficially in the forearm. But the same fate will not continue in the hand. Because let's say if this marker here is the radial artery proximal to the flexor retinaculum only, it goes back, it turns back like this, and it goes into the anatomical snuff box. We will be discussing this anatomical snuff box in a while. So let's say there is an anatomical snuff box there. So it becomes the content of that anatomical snuff box. And then what you'll see, it will continue its journey further and reaches the first web space. Now, what is there in the first web space? In the first web space, there is the muscle present here. That is a dorsal interossei. Dorsal interossei being a bipinnate muscle. So, what you will see, it will enter between the 2 heads of the dorsal interossei. And then we will be seeing it coming onto the palmar aspect here. by coming out between the two heads of adductor pollicis. Adductor pollicis muscle is having a transverse head and oblique head, so it will come out between the two heads. So what happened here? The radial artery goes into the snuff box as the content of snuff box. Then it goes more distally, passes between the two heads of first dorsal interossei, goes through it, and comes out onto the palmar region between the two heads of adductor pollicis. And this is where it forms that arch called as a deep palmar arch. Let's say this is a deep palmar arch here. Not only it is giving a deep palmar arch, if I just write D for the deep palmar arch, not only it is only giving of deep palmar arch, it also gives of a branch which supplies the thumb, and it supplies both the side of thumb, and that's how I call it the princeps pollicis artery, supplying it's a principal artery of the thumb, so we call it princeps pollicis artery, this one here. Also, it gives of a branch which is running onto the lateral side of the index finger. Now, because it is running lateral side to the index finger, or you can say radial side of the index finger, so we also call it radialis indicis artery. That's the fate of what? Radial artery here. Radial artery goes back, comes in front, forms a deep palmar arch, and gives of a princeps pollicis artery and radialis indicis artery. By doing so, the first web space is done. Now we have supplied the first web space. Let me use a different color for the ulnar artery. Now, ulnar artery is the one which will be seen passing superficial to the flexor retinaculum. Let's say flexor retinaculum is here, and it passes superficial to the flexor retinaculum, goes more distal here, and forms this arch called as a superficial palmar arch. Look at that. If this here is the ulnar artery here, you can see it is going superficial to the retinaculum first, and more distally also compared to this one, and that's why this arch here will be called as a superficial palmar arch. Superficial palmar arch. Now what the superficial palmar arch is going to do, it will give off 1, 2 and 3 common digital artery. Look at these. These are the 3 common digital artery, and the reason we call them common digital because they further divide into proper digital artery. Like the one which supplies the second web space, these are the proper digital artery. Then we have supplying it this web space, that is another proper digital artery set here, and there's another set of proper digital artery coming from here. So these are the common digital artery which is further giving off proper digital artery to supply the second web space, third web space and the fourth web space. Still something is left. Well, what is left? The ulnar side of the little finger. The ulnar side of little finger is supplied by the proper digital artery only, but that is directly coming from the superficial palmar arch. Directly coming from superficial palmar arch. Did you get my point? What I'm saying is we have 3 common digital artery giving off proper digital, and we have 1 proper digital artery directly coming from superficial palmar arch which supplies the medial side of the little finger. Medial side of little finger. Now the question is, we have formation of deep palmar arch and superficial palmar arch. The web spaces are also supplied. How these arches are going to complete? I mean, if you're saying some arch, it need to complete also. Now this deep palmar arch here, which is actually the continuation of radial artery, will be completed by the deep branch of radial artery. Deep branch of the, ulnar artery, I'm sorry. So deep branch of ulnar artery completes the deep palmar arch. And how superficial palmar arch will be completed? Superficial palmar arch will be completed by the branch of radial artery which is going to pass superficial to the flexor retinaculum all the way here and then anastomose with this. So although we said radial artery is going back, it is not coming to the flexor retinaculum, but yes, the superficial branch of radial artery will pass superficial to the flexor retinaculum and also helps in the completion of superficial palmar arch. That's how the arterial arcade is present on the hand. So guys, let's now talk about the fate of this radial artery and ulnar artery in hand. You can take your time and draw this diagram first, and then we can proceed from here. Well, let's presume this is a site for the flexor retinaculum. As we have already discussed the details that how exactly these arteries are going to go in and reach the hand, the radial artery, which we said, will be running behind. So the radial artery here, proximal to the flexor retinaculum only, it goes behind, and that will be somewhere in the anatomical snuff box. And the thing is, when radial artery will come on the palmar aspect, it is going to form an arch here which is called as a deep palmar arch. Let's say this here is the radial artery which is going dorsally in the anatomical snuff box. So if I say somewhere here, it will be the content of the snuff box. And then, as we said, it will pass between the two heads of the first dorsal interossei and also between the two heads of adductor pollicis to reach the palmar aspect. And this is forming an arch that is a deep palmar arch. This is going to form an arch. This is called as a deep palmar arch. So just for the reference sake, let's say it is coming out between the first dorsal interossei, and the arch here is what? That is a deep palmar arch. We also said the radial artery will give off a branch which will supply both the side of the thumb, and that's why the artery is called as what? Princeps pollicis artery. So this one here is going to be the princeps pollicis artery. Princeps pollicis artery. Also giving off the artery supplying the lateral side of the index finger. So that was what? That was a radialis indicis artery. It was the radialis indicis. So that was the contribution of the radial artery in here. Goes into the anatomical snuff box, comes onto the palmar aspect, gives off a deep palmar arch, artery to the thumb, that is princeps pollicis artery, and also the radialis indicis artery. On the other hand, ulnar artery, as we saw, ulnar artery is passing superficial to the flexor retinaculum, goes more distally and forms what arch? That is a superficial palmar arch. It is forming this superficial palmar arch. That's the ulnar artery. The arch here is a superficial palmar arch. The superficial and deep palmar arch, they are separated from each other by the tendons of flexor digitorum superficialis and profundus. When you see the arch which is present superficial to tendons of FDS and FDP, flexor digitorum superficialis and profundus, that is superficial palmar arch. Deep palmar arch obviously deeply placed. So this arch is present deep to the tendons of flexor digitorum profundus and superficialis. What superficial palmar arch is going to do, as we already discussed, that it is going to give off these three common digital branches, and these common digital branches are going to supply the second, third and the fourth web space by these proper digital branches. Common digital, I'm writing C, C and C. So these are three common digital branches you're looking at, and these all are the proper digital branches. If let me just write P here for the proper digital branch. It's better if I write it on the side here. C is for common digital artery. C is for the common digital artery, and the P here stands for the proper digital artery. Proper digital artery. And then we also said that we have one proper digital artery coming from the ulnar artery itself and supplying the medial side of the little finger. So this again is the proper digital artery to the medial side of the little finger. And finally, how these arches are completed? Well, deep palmar arch is completed by the deep branch of ulnar artery, like this is the one. That's a deep branch of ulnar artery completing the deep palmar arch. Well, no question about that. If the question is asked, deep palmar arch is formed by radial artery, but completed by the deep branch of ulnar artery. Superficial palmar arch formed by ulnar artery, but completed by the superficial branch of radial artery, which we already discussed, will pass superficial to the flexor retinaculum. That's another anastomosis here. Make sure you remember that when we talk about the relations of the flexor retinaculum, the artery that you will see superficial to flexor retinaculum will be ulnar artery, and the superficial branch of radial artery, not radial artery as such, superficial branch of radial artery will be, these are the two main arteries you will see passing superficial to flexor retinaculum when we will talk about the relations of the flexor retinaculum. So that is how the arterial arcade is present in the hand. The radial artery, it forms the deep palmar arch, whereas on the other hand you can see the ulnar artery is forming the superficial palmar arch, and you can see how they are supplying the web spaces. So that's about the arterial supply of the hand, and with that we're done with the arterial supply of the entire upper limb. So as I said, the axillary artery in the beginning, axillary artery is very important. The branches, relations of the axillary artery with respect to the brachial plexus. Anastomosis around the scapula, very, very important, practically very important, because shoulder dislocation can lead to the occlusion of the second part of axillary artery, and that is where when this scapular anastomosis comes into the picture. Then we saw the brachial artery giving off the radial ulnar artery, talked about the anastomosis at the elbow. If there is a compression, let's say if there is a fracture of the distal end of the humerus, so there are very good chances there could be a compression or occlusion of the brachial artery. In that case, this again, elbow anastomosis is very much needed to maintain the collateral circulation for the rest of the upper limb. We saw the fate of the radial artery, ulnar artery in forearm. The one which is more deeply placed is ulnar, more superficially placed is radial. And we just discussed about how exactly these arteries are reaching into the hand and contributing to the formation of superficial and deep palmar arches.